Chapter 13, Adaptations to Pregnancy. Before pregnancy, the uterus is a small pear-shaped organ that weighs about 2.5 ounces and has a capacity of about 10 mLs. At the end of pregnancy, the uterus weighs about 2.5 pounds and a capacity of about 5,000 ml. Pregnancy and growth is divided into 3 trimesters, with each being 13 weeks in duration. The uterus enlarges as the fetus grows and can help to confirm the estimated date of delivery, or the EDD, or the due date. The top of the uterus is called the fundus, and this is used to detect fetal growth. During prenatal visits, the provider will measure from the fundus to the symphysis pubis for growth of the fetus. Figure 13.1 in your book shows you appropriate growth patterns. A few important points are: at 20 weeks, the fundus should be at the umbilicus, and up until about 36 weeks, the fundal height that is measured in centimeters should correlate with your gestational weeks. For example, if she's 28 weeks gestation, the fundal height should be 28 centimeters. The cervix will make a few changes as well during pregnancy. One is a Chadwick sign, which is a change in the color of the cervix to a bluish-purple color due to estrogen, causing hyperemia, and is one of the earliest signs of pregnancy. A decrease in collagen fibers causes the cervix to have softening, which is called the Goodell sign. The cervix also has a mucus plug that plugs the opening of the cervix and helps keep out bacteria. During labor or shortly before, the mucus plug is released, and the cervix can then begin to dilate. The cervix must dilate to 10 centimeters to deliver the baby vaginally. The breast becomes enlarged during pregnancy and prepare for milk production. The cardiovascular system will make changes to adapt to pregnancy. The muscles of the heart will enlarge slightly due to the increase in blood volume. During the 3rd trimester, it's pushed upward and to the left, so you have to change where you listen to heart sounds. Total blood volume can increase up to 45% during pregnancy. This includes an increase in the plasma, RBCs, WBCs, and platelets. The increased volume is necessary to transport nutrients and oxygen to the placenta, which is the lifeline for the fetus, and to meet the demands of the expanded tissue in the maternal breast and uterus. This extra volume also provides mom with a cushion of blood, since she will have blood loss with birth. The plasma will have the greatest increase in volume and happens earlier, so as a result, the hemoglobin and hematocrit become more diluted. This can cause a decrease in the maternal hemoglobin and hematocrit, which can lead to physiologic anemia. With this increase in blood volume, you will now have an increase in cardiac output. The heart rate will usually increase about 15 to 20 beats per minute during pregnancy. She'll have the best cardiac output when she is in the left lateral position, and deficient cardiac output when she is supine. So a nursing intervention we need to do is always make sure our pregnant women are not flat on their back. Use pillows to prop her off that vena cava to help increase that cardiac output. Blood pressure should have little change during pregnancy. We'll talk in upcoming weeks about high blood pressure during pregnancy and the complications. Positioning can also affect the blood pressure. Being supine once again puts pressure on that vena cava and can cause supine hypotension. Symptoms include dizziness, feeling faint or lightheaded. So what do? You get that pressure off the vena cava. Either turn her to her side, remember left is best, or put pillows under her to get that pressure off that vena cava. There are 5 major changes in blood flow during pregnancy. These include: 1. Blood flow has to be altered so enough can get to the placenta. 2. An increase in blood flow is needed to get to the kidneys to handle the increased work of removing waste from the mother and fetus. 3. The skin needs more blood flow to get rid of the extra heat that's caused by an increase in metabolism. 4. Blood flow to the breast is increased. And 5. The increased weight from the uterus puts pressure on the vena cava, which in return obstructs the blood return to the legs. This causes stasis of the blood and venous distension. If these veins remain engorged, an increase for varicose veins in the legs, vulva, or rectum may occur. Iron supplements are needed many times for the pregnant woman to meet her required guidelines. Leukocytes increase during pregnancy up to 15,000, so not a good indication for infection unless those are at higher levels. During labor and during postpartum period, they can increase up to 30,000 due to trauma and the inflammatory process. Pregnancy is considered to be a hypercoagulable state, so she is at increased risk for blood clots. Oxygen consumption increases by about 20%. The body will compensate for the increase in need by slightly hyperventilating. She will breathe more deeply, but the rate typically does not increase. Hormonal changes can affect the respiratory system as well. Progesterone and prostaglandins will help decrease airway resistance by relaxing smooth muscle in the respiratory tract. Estrogen increases the vascularity of the mucous membranes and can cause nasal congestion, epistaxis, and deepening of the voice. The lower esophageal sphincter tone is decreased due to the progesterone relaxing the smooth muscle. When this occurs, along with the upward displacement of the stomach, a reflux of stomach acid pushes up the esophagus, causing heartburn. The progesterone will also cause the smooth muscle in the stomach to relax, which can result in decreased motility of the GI tract. The emptying of the intestines increase, which allows for more nutrients to be absorbed. A decrease in the large intestine motility causes for water to be absorbed and can result in constipation. Constipation can also cause an increased incidence in hemorrhoids. Progesterone can cause the gallbladder to become hypotonic and cause emptying time to be decreased. When this happens, the bile becomes thicker, and that would put her at risk for developing gallstones. Retaining those bile salts can cause pruritus. During the last trimester, the liver gets pushed upward and backward due to the growing uterus. The levels of alkaline phosphate rise, and albumin and protein levels will fall. There are a variety of changes that occur to the skin during pregnancy. With an increase in circulation to the skin, the woman perspires more and often feels warmer. With this increase of perspiration also comes the increase in acne. Increased estrogen, progesterone, and melanocyte stimulating hormone levels cause hyperpigmentation of the skin. This is more common in women with darker skin and darker hair tones. One area you may see is across the forehead, cheeks, and nose, and this is called milsama colosoma, or the mask of pregnancy. The linea alba is a longitudinal line of the abdomen that marks the midline, and during pregnancy, hyperpigmentation can cause it to become darker, and this is known as linea nigra. Connective tissue changes can cause striae gravidarum, which is also known as stretch marks, that occur on the abdomen, breast, and buttocks. These can fade after birth, but they do not disappear. There's no magic cream that will take them completely away. During pregnancy, an increase in hair growth is noted, and they will notice less hair falling out. 2 to 4 months after birth, the woman can see a significant increase in hair loss, and this will return to normal within 6 to 12 months after birth. Progressive changes are noted in the musculoskeletal system during pregnancy, and most are noted in the second and third trimester. Estrogen and progesterone can cause relaxation of the pelvis joints, and the pelvis may become more unstable. To compensate for this, the woman may take a wider stance, which looks a lot like a waddle. During the third trimester, when the uterus is growing, the woman may need to lean back more to keep her balance. This change in her posture can cause lordosis and can be the cause of backaches during pregnancy. During the third trimester, the abdominal muscles may become overly stretched, causing the rectus abdominal muscles to separate. This is known as diastasis recti and can be either very mild or severe. Human chorionic gonadotropin, known as HCG, is a hormone that rapidly increases after conception and is a hormone that causes a positive pregnancy test. This rapid increase in the HCG levels causes the corpus luteum to produce estrogen and progesterone until the placenta takes over that role at about 10 to 12 weeks. The function of estrogen includes it stimulates uterine growth and is responsible for the increase in blood supply for the uterus. It helps prepare the breast for lactation and can cause the hyperpigmentation of the skin, vascular changes, increased activity of the salivary glands, and hyperemia of the gums and nasal mucus production. A few major functions of progesterone include maintaining the endometrial layer for implantation. This is a major component. Some women who do not have adequate progesterone levels can experience miscarriages due to the fact that the implantation can never occur, or if it does, it won't be able to maintain. Relaxes smooth muscle of the uterus, which prevents spontaneous abortion of the fetus, and it helps with the development of the lobes and lobules in the breast for breastfeeding. Changes in metabolism include weight gain, For a woman with a normal BMI, the average weight gain is about 25 to 35 pounds. This would be increased for someone with a lower BMI and reduced for a woman with a higher BMI. The requirements for water increases during pregnancy as well to help supply the fetus with enough fluid. Dependent edema is also common in pregnancy, especially towards the end of pregnancy. This fluid retention can also make it common for women to experience carpal tunnel syndrome during pregnancy, but will usually resolve within the first 3 months postpartum. Many women have a feeling that they are pregnant before it's confirmed by their signs and symptoms. These women are placed in 3 categories, these symptoms are placed in 3 categories: presumptive, probable, and positive. The presumptive symptoms are experienced by most women, but they are the least reliable that pregnancy has truly taken place. This is due to the fact that there can be other factors that could cause these symptoms. Presumptive symptoms include amenorrhea, nausea and vomiting, fatigue, urinary frequency, breast and skin changes, vaginal and cervical changes, and fetal movement. Probable indications are objective findings that can be documented by the provider and are a strong indication pregnancy has occurred, but still not considered positive confirmation. These probable signs include abdominal enlargement, cervical softening, known as Goodell sign, changes in the uterus. These changes can include changes in the uterine consistency, which is known as the Hager sign, ballottement, which is when a sudden tap on the cervix during a vaginal exam can cause a fetus to rise in the amniotic fluid and then rebound back, and the women can experience Braxton Hicks contractions. These are irregular, painless contractions that can occur throughout pregnancy but do not cause cervical dilation. The last probable sign can be a positive pregnancy test. There are other factors that can cause a positive pregnancy test, so she is truly not pregnant. There are 3 positive indicators that are considered the only positive symptoms of the confirmation of pregnancy. These include auscultation of fetal heart sounds, fetal movement felt by the examiner, and visualization of the fetus by ultrasound.